With over 20% of Burlington's population over the age of 65 and growing, joining me now in studio is Councillor Paul Sharman, who is also a regional councillor, who is tackling this project and bringing some innovative projects actually to Burlington as well. So thank you for joining us, and why don't you share with our viewers today what you've been working on?
Oh my goodness, what a great opportunity and a pleasure to be here. Thank you for having me, Kristen. With respect to your question, we have no choice in this matter. We either do something or we'll be overwhelmed by people who have not got the ability to look after themselves. We have a burning platform, and it is to do with the fact that while we have 20% of our population over the age of 65, we have 30% over the age of 55. We know that the percentage of people over the age of 65 is going to double in the next 20 years and does not peak for 30. And then we have to recognize that the primary driver of hospital patient load is people over the age of 80, and that is going to quadruple in the next 20 years. We cannot quadruple the number of doctors and nurses and operating theaters and beds. So we have to deal with it.
Now, we spoke a bit earlier, and you've been looking at the changes happening across the province right now, and you're seeing a lot of benefits to the new outline for Ontario Healthcare.
Well, the critical factor is that when people become unwell, they are in crisis. And our entire healthcare system is designed to help people when they're in crisis, which is not particularly helpful, because had we done more earlier before people were unwell and managed to help them through those difficult moments, then we would divert people out of the healthcare system into services such as physiotherapy and other services that would help them. I mean, it even comes down to financial support and getting their taxes done and housing. All of that would actually reduce the cost of patient service by 15%.
Now, currently in Burlington, we're seeing some changes happen. So now we've seen transit becoming free. So our seniors are able to navigate around without having to use a vehicle. We're also seeing healthcare changes, free medications also for that population. But you've brought in this new program, and I know you're very excited to talk about it. So why don't you share with us what will be happening here in Burlington and the pilot project that you have?
Sure. So the concept is one that we've borrowed that is known as Program for All-Inclusive Care for the Elderly. It is functioning in 31 states in the United States, and it presently serves 500,000 people. And they expect that that will double in the next 5 years. And what it does is it takes a look at the total needs of the older population, the members. They have to join. And so in that case, they have people who are constantly working with them, and they're called members, not patients, not clients. And they have services of primary care, so doctors and nurses, but they also have people who can guide them through social services, through financial services, and other matters, and is part of a membership program. And our objective is to create a series of centers, if you like, where they can be in the lower level of a tall building, a big building for seniors, so seniors housing, or they could be on a standalone basis in an area where there are a lot of seniors, and people can come in and they can join. They will have a group of people they can counsel with and get guidance from, and that will actually guide them through their lives and help them improve their quality of life and keep them out of hospitals.
Amazing. And now talk to us about the funding development of this and when you believe these centers are going to be operational.
Well, the fascinating part of this is the Ontario government is looking for integrated services and revising the way that the healthcare system works, and that is completely aligned with what we're doing with this Program for All-Inclusive Care. We're down to calling it Program for All-Inclusive Care for Elders. That's the Canadian version. It's a little more polite. And the objective there is to actually participate in that change so that we're offering integrated services while people are still well, and actually we can therefore work within a more integrated service healthcare system, even down to keeping a single record that would be shared between the PACE program and the medical system. So, for example, when somebody reaches a point where they need health care and they need to go to a hospital, rather than having them go to the emergency center, they will be taken by an ambulance organized by PACE to the hospital. They will be checked into the very ward where they will get treatment. After treatment and when they're going to be discharged, they're discharged back to PACE and they're taken back to where their home. So services like that.
So this is truly a one-stop shop for senior care and development. And thank you very much for joining us here today and just giving us a sneak peek as to what you're working on.
It's exciting.
And we will be following this with you as well and bring updates to the community, and hopefully we'll be able to say these are up and working in a very short period of time. So thank you very much.
Thank you very much.
Thanks.
I'm delighted to be here.
Okay.